good morning and welcome to COVID Talk with Local Health Authorities. Joining us is Dr. Sherri Onyiego, representing Harris County, and Dr. David Persse, representing the City of Houston. This is sponsored by the Rotary Club of Houston. Thank you to past President Kathy Finninger of the Rotary Club of Houston for providing these questions. I'm Stephen Williams, Director of the Houston Health Department. Of course, the first question is about NRG Vaccination Center. It's focusing on zip codes. Please explain the process, social vulnerability index, and whether those over 65 from any zip code can go. Actually, there are two different criteria. One is set up by the county and one set up by the City of Houston. They're very similar, to be honest with you. The county uses the social vulnerability index that was developed by CDC. We use the COVID vulnerability index that was also developed by CDC. And the COVID vulnerability index just adds a couple of more factors to the formula to determine a zip code's vulnerability for COVID. Yes, part of our plan, yes, when we say we're targeting these vulnerable zip codes, we are. But in fact, we're not keeping people from other zip codes from actually registering. Actually, if you probably saw in the paper, I think it was yesterday, how we as a city prioritize that. Sherri, you might want to go into a little bit more detail about the county's process.
Yeah, so the county's process is still based on age. We're prioritizing those in a specific age group, 65, 75 and older. But if you're from these high priority zip codes, or these zip codes where we're seeing increased cases, increased morbidity and mortality, increase in underlying conditions that put you at higher risk for developing COVID, those are the priority zip codes that have been identified, and their priority will be weighted equally as those who are not from those zip codes and are at a higher, in that age bracket. So very similar. And I'll just add that the social vulnerability index looks at a number of factors like resiliency, how a community can bounce back from disasters and pandemics. And so we look at things like transportation, economic stability, or instability for that matter. So
FEMA is setting up community vaccine centers. Please update us on locations. Please confirm that the registration process is the same for all sites. No, it's not. Ready, Harris, City of Houston online and phone, and now FEMA. Should I just register anywhere? Well, the question is, yes, you can register anywhere. If you go to the county site, you will also see how you can register on the city site for NRG and vice versa. The feds are, in fact, going to ship vaccine to federally qualified health centers. The federally qualified health center that's designated to get a direct federal shipment here is actually Legacy Health Clinic, and I think there are probably about half dozen locations that would be recipients of that. We also know that the feds will be shipping vaccines directly to certain pharmacies, HEB, CVS, and
Walgreens?
Not Walgreens, it's Walmart's.
Okay.
Walmart pharmacies. We have less visibility on the amount of doses that are actually going to go to the pharmacies than we do on the FQHCs. But the more information we get, we'll update people on that. And the whole purpose is to have a diversity of strategies to really tackle the issue regarding access. CDC's roadmap for opening schools is to open schools but not wait to vaccinate teachers. There's a major disagreement in school districts, with the average age of those contacting the virus well within those who are teaching. Is that still wise?
Well, so I looked at that plan. I can't say that I studied it, but I looked at the CDC's plan, and what it points out is what we've come to learn is that the classrooms are generally not the high-risk places. It's the after-school situation. But the flip side of that you have to keep in mind is the classrooms appear to be relatively safe because they don't have 100% occupancy in a lot of these communities. So the CDC's plan talks about how much viral activity there is going on in the community, and also talks about how many kids are going to go to in-person training. And so there's a formula that they recommended to help schools open up. But the other thing is that we got to keep on is the consequences of kids with the online learning is there's some kids do great with it, and a lot of kids have a lot of trouble with it. So, so they're trying to do the right thing, but in a balanced message. So.
Yeah. The only thing I would just add too is that also the CDC points out that as long as the schools also put some of these protective measures in the classrooms, the adequate spacing. They're still recommending masking. All of those prevention measures don't go out the window to ensure that the classrooms are made safe. Teachers definitely, certainly we have made accommodations and tried to incorporate them in our plan as well. If they don't fall with, obviously the 1A specifically for our prioritization names healthcare workers. 1B really focuses on age and chronic conditions, and certainly teachers or administrative staff or support staff that fall in those categories, if we've been able to make contact with them and put them on our list as well, and have incorporated them in our no-show policy.
My MS meds modify my immune system. Should I still get the vaccine?
Well, yeah, but if you got MS, you need to absolutely talk with your physician, because it's not only that you got MS, but what medications are you on? So,
Right.
So generally, the rule of thumb is with any chronic illness, you should get it, but the more complicated your illness is, the more important it is that you talk with your doctor before you get vaccinated.
Absolutely.
Anecdotally, it appears older adults have less reaction to the vaccine. Is that being studied, and why might that be?
Yeah, I don't know if that's necessarily the case, or if that's something that's been widely discussed. I just know that obviously everyone's immune response to the vaccine is going to be a little bit different, but certainly having less response in older adults is something that I don't recall seeing reported.
Is J&J vaccine considered a live vaccine?
It is. Yeah.
Yes. When available, will J&J be limited to use in difficult to reach areas and countries that cannot deal with the storage requirements?
Well, we know it's not going to require the special ultra frozen storage like the Pfizer does, and certainly that certainly will make it a lot easier to handle for some entities, just based on that
I've not heard from
alone.
the feds or the state
Yeah.
about it just being used in rural. But the other thing to keep in mind is when it first comes out, there's only going to be a little bit of it.
Right.
It's going to take a while before they ramp up. So.
Yeah, the question is, when will it arrive in Houston? We don't really know
Yeah.
that. We don't know that yet. Will each location announce the vaccine they are giving? Will we be able to choose which one we receive by location? Interesting enough, with the Expert Vaccine Advisory Committee for the state, we had that discussion yesterday. I think we were leaning toward no. I mean, we will look at providing it to providers, but if individual people had a choice, it sounds like that would be chaos. What's your opinion on that?
Yeah, definitely. I think that we actually had that discussion this morning on one of our calls, trying to figure out how that would be operationalized. It would potentially be a nightmare, and certainly be a lot of chaos.
We're having enough trouble getting people to get their second dose.
So I'm glad that y'all backing me up. Thank you for joining us for COVID-19 Talk with Local Health Authorities. We'll be right back.
Hi, I'm Simone Biles. Mask up like a champ to protect yourself and everyone else.
As we reopen our city, it's important that we do it safely. Continue to wear your mask in public.
Wear it like a champ.
Mask up, Houston.
I work out every day. COVID won't kill me.
I'm 24. COVID won't kill me.
I have antibodies. COVID won't kill me.
It's been a long week. COVID won't kill me.
I'm 25. COVID won't kill me.
I'm partying outside. COVID won't kill me.
I don't need to wear a mask around my friends. COVID won't kill me.
I'm 23. COVID won't kill me.
If I haven't gotten it yet, COVID won't kill me.
I'm young. COVID won't kill me.
Famous last words. Don't let them be yours. Socially distance. Mask up, America.
Houston, we have a problem, more like a pandemic. Third ward to fifth ward, we can't afford to lose this. A-Leaf Acres Home, Sugarland, and Sunnyside. We know it's hard to stay inside. You are not alone. And when you do leave, mask up. If not for you, then for other Houstonians. That keeping your distance is still the safe thing to do. Remember, there are people on the front lines. Show them we still have their best interest in mind. Please wash your hands and get tested. This is Houston, and we must protect the H.
Have questions about the coronavirus?
I'm here to share some simple steps you can take to help protect yourself and others.
Avoid touching your eyes, nose, and mouth. Wash your hands often with soap and water for 20+ seconds.
Cover your cough or sneeze with a tissue.
Clean and disinfect surfaces and objects. Wash hands after touching commonly used items.
Together, we can help slow the spread.
The fight goes on, because just when you think this opponent seems to be pinned down, it comes back to life. So keep your guard up, because if your mask comes off, the fight is lost for all.
Wash your hands, avoid sick people and touching your face. There are everyday actions to help prevent the spread of respiratory diseases. Visit cdc.gov/COVID-19. Brought to you by the National Association of Broadcasters and this station.
Downtown is an art lover's dream with more than 65 pieces of public art.
Thank you for joining us for COVID-19 Talk with Local Health Authorities, sponsored by Rotary Club of Houston. Why does it appear that vaccine protections vary by country?
You know, that's a good question. The one thing is, in some of these studies that I've looked at, it's because there's different variants that are circulating in different countries. That's the easy answer. I don't know, do you have any other?
Yeah, and I think that, I think one of the countries we hear about the most is Israel. I mean, they've had a great success, but then you got to think about comparison of the population versus a country that's almost the size of a county, and so it's different. I don't know how equal those comparisons are when you sort of drill down to it, but definitely the variants have been a big component of that. And also their ability to really hone in on a lot of the prevention measures that we know work. How they've adopted it versus how we've adopted it in the U.S.
So it's not just about the vaccine itself.
Yeah, good point. No.
Yeah.
Are direct comparisons of the vaccine available?
I don't want
you mean like Moderna, just side-by-side comparisons? I would think that the CDC and the FDA have those kind of side-by-side comparisons.
Yeah, you might want to go to the CDC's website to see whether or not they have
just
that.
yesterday, there was the real-world experiment with Pfizer came out. I was looking at the Israeli and found it was very good. The real-world experience very much matched what they had in the preliminary trial, around 94-95% protection.
I have surgery coming up and finally booked a vaccine date 7 days before. Should I get the vaccine or wait?
Yeah, I would say get it. Yeah.
Again, I'd say check with your surgeon, but I can't imagine they would have a problem with it.
How far behind did we get because of the storm?
Well, we know that testing was impacted. We know that vaccination efforts were impacted. In terms of putting a quantity on it, I mean, certainly we
usually get pushed back at least a week.
Yeah, because they're rescheduling people, and I think a lot of that is actually still happening. The impact with power and moving things along from that standpoint. So yeah, I think it definitely set us back.
Yeah, we were not operational for 4 days, and we were able to do second shots on Saturday and Sunday, but we didn't do first shots because we had to use the vaccine that was allocated for first shots for second shots. So it's going to take, I think in a week or so we'll probably catch up. My daughter tested negative 4 times, excuse me, while having symptoms, and weeks later tested positive for antibodies. Is there any test that is completely accurate?
No.
No?
No. Every test has its strengths and weaknesses. Yeah.
On to a research question. What is the status of trials for children?
Well, yeah, I mean, right now they're still underway, especially with Moderna. We know that right now Pfizer's approved for 16, that age group and above, Moderna 18, but now they're doing studies down to, I think, the age of 12, if I'm not mistaken.
Yeah, I kind of read that there's also one, I don't remember which one it was, looking at 6 and above.
Yeah, I think that was, I'm not sure if that was with Pfizer or with Moderna. But yeah, my understanding is that we should have some additional information about those, and that the anticipated goal to have them ready for at least that lower adolescent age group is somewhere around the fall, so that they can have those vaccines for kids for this upcoming fall. But then it's going to be additional studies for the younger age groups, which will be a little bit further out.
Are the tests primarily related to the amount of the dose of the vaccine or something else?
I don't think they're looking so much at the amount of its efficacy.
Well,
safety first.
Safety.
Right, and then efficacy.
So the dosage is the same for children and for adults?
I don't know specifically.
Yeah.
I don't know.
And historically, because children as well as pregnant women, that's what they're looking to find out, what's the right sort of effectiveness efficacy, as well as if there's a different variable in the dosages. And I think that is something that they're looking at right now.
Okay. AstraZeneca is being tested for ages 6 to 17 in the UK. How many cases have to be seen since this has already been tested, and this is just a change in age? Will the FDA accept the UK trial, or do they have to do their own here?
So what they're asking about, what is the power analysis? So based on the adult experience, you can do what's called the power analysis to figure out how large of a study you need to do in the next age group. So I don't know what the answer is to that, but I know that's the process, and it's called the power analysis. So I'm sure they've calculated that, and they're powering, or they're sizing the study to meet that power analysis. And yeah, the FDA does accept results that are done when trials that were done in other countries. In fact, even the Pfizer and the Moderna, many of those folks were in the United States, but many of them were international. So.
They were.
Novavax is being talked about as possibly stopping asymptomatic spread and providing longer protection. What is the medical community saying?
I don't know, we have an opinion.
I don't have any information on that one.
No information. Okay, please explain deletion mutations.
Oh, deletion mutations?
Deletion mutations, it's like well, first, every virus replicates, and when it replicates, sometimes it makes mistakes. Sometimes it makes mistakes that are insignificant. Sometimes it makes mistakes that they do have a consequence. It could have a clinical consequence. And so the deletions are like removals of certain nucleotides in those proteins. And so that's what the deletions are no longer there. So they actually occur when the virus is replicating and it's taking out those nucleotides.
The importance of that is if you understand the way that the RNA and DNA is read, there are 3 nucleotides in a row, or kind of like a word. Right? Think of that as a word or something. And when you delete one, it shifts, because it's the ribosome is going to read in sets of 3. So not only does it change that sequence of 3, it changes everyone from there on out and as well.
A new study theorizes that rising temperature decreases new cases. What seemed to have debunked this last summer in Houston? In retrospect, does the data show a decrease?
Yeah, I think if this virus taught us anything, number one, it was violating every rule.
Yeah.
And the weather rule, it laughed at. So.
Yeah. And again, I think that kind of back to what we were talking about earlier, if we're not putting in those prevention measures to really help us to get to where we need to go, despite warmer temperatures or not, if people are gathering and there's no prevention measures in place, it's really going to be, create a difficult situation.
So it's really up to us. What is a polyvalent vaccine?
Polyvalent vaccine?
So yeah, monovalent and polyvalent. So monovalent is like just one strain of that particular antigen. So like an example of that would be like the measles vaccine. A polyvalent is like 2 or more strains or antigens of a vaccine. So mono is 1, poly is 2. So you have like different vaccines that have multiple strains that compose that compose or make up that specific vaccine. Oral polio vaccine is a good example of a polyvalent vaccine. So it's just multiple strains of that particular antigen.
Okay. Thank you for joining us for COVID-19 Talk with Local Health Authorities, sponsored by the Rotary Club of Houston. We'll be right back.
Houston, we have a problem, more like a pandemic, and now it's all of our responsibility to make sure we end it. So this is a declaration for us. 3rd Ward to 5th Ward, we can't afford to lose this. It doesn't matter which state open first. We cannot allow this virus to get worse. Memorial, Main Street, A-Leaf, Acres, Home, Sugarland, and Sunnyside. Trust, we know it's hard to stay inside of your home, but you are not alone. And when you do leave, mask up. If not for you, then for other Houstonians. River Oaks, West U Heights, Higham Park, Galleria to Greens Point. May we point out to you that keeping your distance is still the safe thing to do. Remember, there are people on the front lines. Show them we still have their best interest in mind. East End, 2nd Ward, Midtown, and MLK. And if we didn't name you, the same is true. We all have a job to do. Please wash your hands and get tested. It's time we invest in this great city, because where others may not have a solution, this is Houston. And we must protect the H.
I hear someone go, "Didn't it come from you guys?"
Strangers cough at me.
Move away from me.
Someone spit towards my direction. All the stereotypes that we've worked so hard to break are just gonna be reversed. And I won't let that happen.
We all have to play our part.
I donate my plasma.
I've been making masks.
We deserve respect as much as everybody else.
I'm a firefighter, not a virus.
I'm a mask maker, not a virus.
I'm a nurse.
I'm a delivery woman, chef, a neighbor, artist.
Bus driver.
I'm a doctor.
Fight the virus. Fight the virus.
Todos tenemos nuestras pequeñas rutinas. Cosas que hacemos casi sin pensar y que no podemos olvidar. Que repetimos una y otra vez por nuestra seguridad y por la de nuestra familia. Ahora tuvimos que añadir algunas más para proteger a todos. Cada día cuenta. No te olvides. Ponte la máscara. Distánciate. Lávate las manos. Hazte la prueba. Hazlo siempre. Haz que cuente.
Wash your hands, avoid sick people, and touching your face. There are everyday actions to help prevent the spread of respiratory diseases. Visit cdc.gov/COVID-19. Brought to you by the National Association of Broadcasters and this station.
Welcome back to COVID-19 Talk with local health authorities. The CDC indicated the overall life expectancy in the entire U.S. has dropped a full year, COVID-related or other factors.
Well, I think a lot of it's probably COVID-related. We've had a lot of deaths, 500,000 deaths in the last year that were, unanticipated. Although the life expectancy in the United States did shift, and it was getting better and better and better. And over the last couple of years, the rate of it, did it actually downturn?
It did.
It did, didn't it?
Definitely for African Americans, it dropped by at least one of the studies that I saw was like I think by two years, especially for African Americans. Obviously, the other issues on top of that COVID has, sort of unmasked is that there are already chronic sort of infrastructure issues with access to care and, a lot of social economic factors that already contribute to that. And then when you add a pandemic on top of it, it just, it just creates more and more of a disparity.
The positivity rate of new cases appear to be decreasing nationwide. Texas Medical Center is seeing the lowest reproduction in positivity rate in months. Does looking at the TMC mirror the city? Does this reflect Super Bowl weekend?
So I'll take a stab at that. So number one, the pandemic is not over. Okay, let's start off with that. Pandemic's not over. The R value that TMC calculates, the positivity rates are coming down. But my theory, this is Dave's theory, is that if you look at the timing of this last wave, it began at Halloween, and then Thanksgiving, and then the Christmas and other December holidays, and then New Year's, and then things started getting better. So I don't think that it has anything other to do with the fact that we dropped our guard in the last quarter of last year, 2020. And now the holidays are past us. Super Bowl probably has a little bit of tick. I think that this winter storm we had, that's probably gonna be a little bit of a tick up. But those holiday season, that's what caused that wave, in my opinion.
Okay, we got some related questions. More and more experts are saying we're close to herd immunity, simply because of the number of people who are contracted the virus. Is this wishful thinking?
Well, we're waiting.
No, I think it is. I think it is some wishful thinking because we do know that there's a level of immunity that people get from natural infection. But again, as we've talked about many times on this show, that's short-lived. It's not long-lasting. And certainly your best benefit is going to be with getting the vaccine. And I just, we're trying to ramp up efforts, but we're certainly not at a point where we have enough to vaccinate the entire population to get to that true herd immunity. So we're going to have to continue to do a lot of the prevention measures that we have in place. And the masks are still, at this point, we still need to wear them.
Dr. Outfit in Philadelphia said, I don't think we're going to see a big fourth surge. I think we're seeing the worst of it. Do you concur?
If we were without the variants, well, we need to get the prevalence studies completed, right? So that's the big thing. But assuming that the prevalence studies show that there's a high amount of immunity in the community and that we had just the one version of the virus, I would say perhaps. But with these variants, I don't think so.
Right.
Toronto doctors warn that if a fever or runny nose, children should be tested and stay home. Is that a good recommendation or too cautious?
I don't think it's too cautious per se, but I mean, I think that, in this day and age where we're in the midst of not only just COVID, obviously we're in the middle of cold and flu season as well. Certainly you got to work up the full differential to just rule out the worst case scenario. So, I mean, if it were my child, I would, obviously do the full workup.
Well, should you really be sending a child to school with a fever?
No.
Oh, no, absolutely not.
I'm just
Absolutely not.
saying,
I thought
so.
you were asking, should they get tested? But
Yeah.
no,
Yeah.
absolutely not. If you're sick, stay home, and same advice goes to parents
The
with
other
their
message
children.
of this whole thing we don't want to lose is the
Yeah.
fact we've had basically no flu season this year.
No.
We've had basically no cold season this year. And remember, children die of other things besides COVID. They die of respiratory syncytial virus, and they die of other, childhood. And we've had almost none of that this year because of all these things. So yeah, if we were more diligent over the past decade in hand washing and distancing during the flu season, and of course we weren't wearing masks now, maybe we should have been. There'd be a lot of Americans that still be alive today.
That's right.
My sister's in the hospital, and even though the doctor tried to get me in, that hospital said no. Do you see hospitals in general opening up more to visitors?
Not anytime soon.
Yeah, I don't see that yeah.
Okay, some countries are looking at a vaccine passport for international travel and attendance at public events like concert. Any idea of what the U.S. is looking at? Is there any discussion about using vaccine cards to permit access to activities, travel stores, and et cetera? Actually, that was talked about months ago, I thought, but I don't know where that went. What do you think?
One of the problems with that, we talked about that this morning on our other call, is that there, counterfeit cards are already out there. So
Yeah.
Wow.
Yeah.
Variant status locally. Theories say the new variant remains in the body longer, which is why the spread is greater. Do you predict a longer quarantine period for the variant?
I haven't heard.
Yeah, I haven't heard anything about it yet. I think the thing to keep in mind with some of these variants is that they are more contagious because they can attach, their attachment into the cell entry is different, and they can attach a lot easier. But in terms of changing the quarantine length or duration, we haven't heard anything about that.
How would a person know which strain they have quickly enough to take action? And would the action be any different than other?
I think the action would not be any different.
Yeah.
You'd have to get sequenced. So.
Yeah, I was going to say the action wouldn't be different, still the same thing, and then the additional sequencing is still.
Given the new environment with the variants becoming more prevalent and vaccines still scarce, when is it safe for a high-risk person to undergo an elective surgery? That's a good question.
Good
Yeah,
question.
it is a good question. I think that kind of goes back to what we were saying earlier. I think that those are the conversations you have to have with your physician to determine what what the risk and what the benefit is. Yeah. Because there are some things that are considered to be elective that truly is difficult to say.
Well, right.
Yeah.
It's not, elective isn't an on or off sort of thing, right?
Yeah.
So you've got a cancerous tumor that's not causing big problems right now, although it's potentially spreading.
Yeah.
So, how big is, some cancers, they develop in places where they're impinging on other things, and you're going to die if you don't remove that tumor, right? Because just the bulk of it's going to kill you.
Right.
Versus others that are growing and they're relatively small right now, but they could be potentially spreading. So, which is elective, which is emergent.
Right. And I'll just add one additional thing is that a lot of things have been put on the back burner because the community is afraid to just access the healthcare system, even for traditional preventative care measures. And I think that it kind of goes, not the exact same line of topic, but certainly similar. I mean, people are foregoing preventative screening tests, colonoscopies, mammograms, their annual physicals and checkups because of that. And so I definitely want people to still know that they can, access those things in a safe manner.
Has data on vaccine response to variant strains been public, or is it being hidden? Well, I know it's not being hidden.
No.
It's not being hidden. But there's a little bit out there looking at, like, for example, with the Moderna looking at the South African variant. And so there's some information. Nothing's being hidden. I can't imagine anything being hidden.
No. And I will say that CDC is ramping up efforts to do those additional sequencing, and they're, over the last couple of months, they've been ramping up those efforts and certainly looking at that across the country and state by state of what those variants are looking like from community to community.
Yeah, and we've been looking at some stuff relative to wastewater. Maybe we can talk about that a little bit next week. But I want to thank everybody for joining us for COVID-19 Talk with local health authorities. Dr. Sherri Onyiego, representing Harris County, Dr. David Persse, representing the City of Houston. Thank you to past President Kathy Finninger, Rotary Club of Houston. I'm Stephen Williams, Director of the Houston Health Department. See you next week.